come down here.
Oh my goodness, I can't even think this is real.
Turn, let me see the backside. Okay, awesome. Good morning, everybody. Today, I'm Dr. Sue, by the way, at Artlipo, and I'm a specialist in doing lipedema patients. And today I'd like to talk to you about something that we do very frequently here that I would say is a very special thing that I think very few doctors do. And I call this the knee complex, which is this area, circumferential or a Lipo 360 from here up to here. And compared to what doctors call knee liposuction, traditionally, all doctors doing lipo do the knee, but they do this little area, this little bulge right here. And by the way, my volunteer Mary here has had knee lipo before, and you can see that the doctor did a little bit and left this little dip-de-doo right here, did some already right here, but there's still a lot of fat coming through all this area. So the principle of the knee complex is make the leg slenderize and come to a narrow point, like the thinnest point right here at the knee. Not wider, as you can see right here, she widens out, and then there's some other contours that come in right here that are very beautiful that we want to bring out. So it's the knee complex is a Lipo 360 treatment of the knee, a high definition treatment. And in addition to just getting this area, you see here's a bulge here, there's a bulge here, there's a thickened area here, and there's actually a natural inward contour of the leg in this spot right here. And this is an area where there will be a slight contour out where the knee bone is, but then it cuts back in. So this, let me show you right here, is what the shape of the knee should look like. And you can see compared to the one that I'm not holding, it totally transforms the legs. And that is the purpose of the knee complex. And then what we'll see in addition to this shape, is that you'll see the nice shape of the kneecap too, which is being hidden by all this fat. Very, very common condition that women have. Even women who are on the thin side can oftentimes have a fair amount of fat coming down around the knees. And this little spot right here, see, this is all fat right here, and we want to have this inward contour. See, look at this. If I just hold just that inward part, you see how that already makes a huge difference. We want to have it from this side, then we want to have it all the way around, and that's what's going to make the difference. So that's the knee complex. That's why it's so much different, and it's so much more complete. Thank you very much. Bye-bye. And this is Mary. How you doing, Mary?
I'm doing great.
Awesome. So Mary's here today to do some liposuction with me here at Artlipo. And here at Artlipo, I do specialize in treating lipedema. And this morning, Mary came to treat some areas of her thighs. And we had looked at her lower legs in our consultation, our virtual consultation, because she's from out of state. But she happened to watch one of my videos, right? And
yeah.
What happened?
I watched one of your last videos and I felt like there were many similarities with your last patient in that my legs have always had a lot of tenderness. They have always been heavy, regardless of how thin or athletic I could ever get.
Right. So one of the video going back was one of the lipedema ladies.
One of your lipedema patients.
Okay.
And she was describing what she had felt through her life, and it was very similar to me in that, no matter what you try to do, it's always still remains.
So what we talked about was this video, and she realized that she had a lot of similarities with one of the patients that had lipedema. So we've been talking about that this morning, and we're changing our plan. So instead of doing some of the upper thigh areas, she felt, okay, maybe it's more important to do the lower legs, the ankles and the knee areas. So sorry to interrupt, and so I thought you had a very interesting story, so please go ahead.
So I guess I noticed, I thought it was maybe slightly genetic, or there was something wrong because no one in my family had it, but really it's just a heaviness, carrying around heavy weights, that's the feeling. And it's always seemed like it was poor circulation, and that my ankles would never get thin no matter how thin I was. And then it kept on increasing through time. So what
Tell-
initially was
Tell
something,
them when you started feeling your symptoms. When you were telling me when you
I
were...
would say my teens, my 16, 17,
Mhm.
in that I was looking at pictures just now recently, and even though I weighed at least 20 pounds lighter, I could still...
Your upper body was
Yeah,
really thin.
my upper body was thin. I could see like my bones, and my legs were still heavier than my body, including my ankles.
So tell them now, at 20 years old, you went and you had some...
At 20 years old, I went and had a very generic type of liposuction, and where they reduced my fat throughout my legs, but not necessarily sculpted anything.
But mainly it was an issue, you went for your legs, right?
Yeah, I went for my legs, and in retrospect, yeah, there was some slight betterment, but throughout time, it really wasn't.
But the problem was already there when you were...
The problem was already there.
And so Mary did have a little bit of lipo done. It was pretty, she had some lipo done on her middle thigh, knee area, and then down around her ankles. And it was probably what your general doctor, would do. He didn't really get into doing a circumferential or,
No.
very involved case, but tried to take a little bit out right there.
Yes.
So it made some difference for her. Right? Okay, so now fast forward 20 years.
Fast forward 20 years.
And it's gotten worse, right?
It's gotten worse, and the reality is the knee area is still pretty much the same as before I got that lipo, and so is my ankle area.
So I'm gonna,
Overall heaviness.
so I'm going to tell you, when I started talking to Mary, I was asking her, hey, do you have lipedema? And she was hesitant. She's like, well, maybe I do. Well, then as we started talking, she goes, yes, you have tenderness. Oh, yes, I have tenderness. And then she started talking about how it's heavy. I'm like, well, there you go. There's another thing. It's, it's heavy all the time.
It is.
And then what you tell me, you start saying, okay, and I can't cross my legs like this, and it hurts if I do that. And like, oh my
And it hurts when I
God.
wear specific shoes around my ankles, and I can't wear zip-up boots.
Right. So, and she was telling me, well, I thought that's how,
Everybody.
that was normal. That's everybody. So no, it's not normal. Those are things that hear all the time coming from women who have lipedema. And it's not normal to have tenderness in your legs, or to have to avoid touching your legs, or to have other people avoid touching your legs and such. So, it hasn't stopped you in your life, right? The pain symptoms.
It hasn't necessarily deprived me of anything, but I do make kind of like adjustments, right?
So lipedema can progress very rapidly throughout life, and I don't know if it has progressed for you as far as the
I
symptoms.
feel like it has.
Okay, but it's better to treat it early. You don't want to live throughout your life and be in your 50s and 60s and then say, okay, now I'm going to do something. If you have symptoms in your 20s and 30s, just know that doing the lipo and doing it well, removing the fat very completely, can really resolve just about all the symptoms. And from what we know, it's a very lasting treatment. It's not something that's going to... It's not something that should come back. Okay, I'm not going to say never, because you can't do that, but it is a very lasting treatment. So yeah, you don't want to wait. If you know you have lipedema, you can halt the progression by a good comprehensive treatment. So anything else you want to add to them?
No,
what
I'm
you
just
expected to do?
very excited about this. I've seen the videos, I've talked to you, and I think this is the right move.
Great. So we can see, hi Mary.
Hello.
Here, nice and thin, but as we come down here, can you move your hands out of the way? So I'm just, showing them their legs right here. Can you just turn a little sideways so you kind of do like this? Yeah, sideways. No. There you go. And then turn the other way. Good. And then let's have you face the screen right there. And take a step closer. There we go. Okay, so for our audience, her legs are a lot different, so let me turn back around. Okay. So in any case, we will start with what I call the Cankles and the knee complex, which is starting down here and coming all the way up about mid-thigh. I call it the knee complex because when we're doing the knee, it's not just a little area right here. We're doing a circumferential treatment around the entire knee this being the cankle area, this being the knee complex. And what we're achieving, just make sure you come down, is that we're trying to get a thinned out area that shows curve and the full slimness around the knee, making it the narrow point. This is something that I would say very few doctors have ever done. It's more apt to describe that as a circumferential or a lipo 360 of the knee. So that's going to make a really big difference in the shape of Mary's legs. Okay, so we'll come back and show you the results a little bit later after we finished, okay? Thank you. Okay, hi everybody. So we're talking about the knee complex. I just want to show you this is what we're doing right here. The knee complex extends from here all the way to here, and we're almost finished with this one side, and this is how we do lipo. Our patients like, hey Mary, how you doing?
Doing great.
Okay, cool. And so patients are wide awake. Hold it tight a little bit. Tighten it up. Okay, good. Hold it tight right there. So when I do lipo, it's a little bit like a boot camp. I'm your coach, and I ask you to hold the muscles tight so I can feel as I'm sculpting around the shape of the muscle underneath, so that we get the accurate high definition look. So anyways, you can see right here, can you see that? Okay, we zoom in a little bit. You can see this is our starting leg right here. And we were like this when we started, and now we have this nice curve coming in. Can you see that? Okay. I'm going to keep working a little bit on this. So these areas working around the knee are very uncommon for other doctors to do. They are very fibrous, and they require, okay, come in here, right over here in this. Okay. And they do require a bit more effort to break that fibrous fat free. Okay here, Mary?
Perfectly fine.
All these areas around the knee, which are these little bunchy bulges of fat, can all be treated. Hey Mary, how you doing?
Doing wonderful.
Okay, for our audience, we just finished sculpting the right leg, as I think you can see here. I'm showing you guys. Roll just a little bit back and forth, very slowly, just roll back and forth. Okay, roll back the other way. Good. Okay, put it straight again. Okay, so I'm showing you guys the definition that we brought out at our knee. That's the knee complex. And then we come down here. You can see how toned her leg is, and then compared to the other one right there. How was it so far?
It's been great. I can't complain.
Okay. For real, you're a real person, right? Yeah, okay, cool.
I'm a real human being.
Okay, come on down, Mary. And I'm just gonna be behind you. Go right up to the mirror, okay?
Oh my goodness, I can't even think this is real. Oh my goodness, Dr. Sue! That is crazy! I can't believe it. It's like the leg of my dreams. Every time I thought of a perfect leg, this is the leg I wanted. This is crazy, I'm so happy.
Turn and face me here. Come a little bit over this way. Come just a little bit there. No, stay on the pad. Right there. Okay, good. I'm just showing everybody. Keep the legs a tiny bit apart. Good. Then turn around for me. Let's see the backside. Awesome. Okay, turn sideways and do that little staggered,
Like this?
Yeah. You stagger the legs. Oh, I like that. Oh, yeah. Flex it back and forth. Like you're doing. Okay. You got your calf muscle. We got the Achilles.
I can't believe it. I've obviously never been able to see my ankle before.
Okay, cool. So, Mary, I'm going to cut it off, and then we'll go back to doing what we're going to do, okay? Okay. Thumbs up? Is that thumbs up?
It's a 2 thumbs up.
Awesome, okay. Okay, here we are. Lift it up. And what were you just saying?
that this is crazy. Look, this is an actual skinny toned.
Okay, bend it a little bit. So you just gotta move it and flex it around here so we can see all the definition. And I was telling Mary that the knee, would you turn it straight up, straighten it out? Straighten it out, okay, that the knee actually looks pretty. There's not bulges all over it. And you have the nice calf definition around it too?
This is another person.
Okay, all right. Okay, so everybody out there, we just finished the second leg, so here she is. I'm gonna turn facing me just a second, okay, Mary? Good, there she is. Turn, let me see the backside. Okay, awesome. Okay, go ahead and take a look. You can look in the mirror here.
Oh, this is incredible. This is so incredible. These are my hidden legs
Yeah?
that were there.
Okay.
And then you came, you made them come to life. This is so crazy. They look so pretty. So pretty. I love them.
Awesome. Okay. You feeling okay?
Yeah.
All right. Well, we're done. I know it's been a tough day for you. Yeah, not so easy sometimes, right?
It's not so easy, but it's completely manageable.
Uh-huh.
Once you get the hang of it, I think you start getting into a flow and you're
Okay.
fine.
All right. Yeah, because you started off anxious, right?
Yeah, I was anxious because I didn't know what I was getting myself into.
Yeah. But,
And then eventually it was fine.
just like relax right into it. Huh?
Yes.
Okay, great. Okay. You want ready to come on?
Thank you.
Okay. Say goodbye.
Bye.
Okay.